should you bleed as a woman that's using hormone replacement therapy? Should you have any vaginal bleeding? So you've made it to menopause, you're postmenopausal, you're using hormone therapy. If there's two options on whether you bleed or do not bleed, your doctor has to give you that option. If you choose, I don't want a period and I don't want to bleed, and you take progesterone every day, you're not supposed to have a period. When you have vaginal bleeding at that point, you no longer have periods. You actually have what's called abnormal vaginal bleeding on hormone replacement therapy. So any vaginal bleeding on hormone therapy needs to prompt some kind of investigation. What is your hormone level? Did you forget to take your progesterone? Did you forget to put a patch on? Did you forget to put the estrogen cream on? What is going on here exactly? Do you have uterine polyps, fibroids? What's going on? You need to talk to your doctor's office immediately. You need to report the bleeding. You probably need your levels tested. You probably need a consultation, and you most likely will need a pelvic ultrasound. The other option is women decide, I'm going to have progesterone 10 days to 15 days a month, just like I used to when I was young and I had cycles, and that's mimicking nature and probably a little bit more physiologic. And I'm going to allow my body to have a period if I have enough estrogen, which means that if your estrogen dose is low on your patch or cream or whatever is happening to your body, you will not have a period even if you take the progesterone 10 days a month. If you have a certain pattern of bleeding where you bleed 3 days a month on day 10 of progesterone every month, and suddenly you bleed unusually early, or you just don't bleed at all for 3 months, now you start bleeding. Those are all abnormal bleeding, vaginal bleeding episodes that need to be discussed with your physician. When you're on hormones for hormone replacement therapy or for hormone therapy at menopause, you do not have periods when you bleed. It's an abnormal vaginal bleeding. It's not okay to have it unless your doctor reassures you and says, oh yeah, that's expected, that's normal, don't worry about it. I please encourage you to report it to your doctor, discuss it with your doctor, be aware of it, and do not ignore it. I have more information about this on my podcast episode, To Bleed or Not to Bleed. Please go to Wellness Optimizing Warrior MD on wherever you listen to your podcasts, and there's an episode called To Bleed or Not to Bleed on hormone therapy after menopause.